motion to approve the minutes as stated.
Second, approved.
Okay.
Okay. Just in case someone is here for that, the APD quarterly report is not on the agenda, has been removed from the agenda. I have not been informed exactly why. Maybe someone can explain me, but it's not on the agenda.
And I apologize, I was having a, can you repeat the question?
Why the APD quarterly report is off the agenda.
So I think there was some confusion about who's to present, whether it would be Chief or Wade Wood. Do you have any additional on that? I don't need any, we could do it. So, yeah, but we will get an answer for you, find out exactly, but I do not know why it's not on the agenda.
Or when it will come
Should
forward.
be in December.
And the next one?
I'll find out, sure. We will make sure it's definitely on December.
Okay, and tentatively, we're going to move the next meeting would have been on December 24th. We're going to move it to the 17th. Okay.
December 17th.
Yeah, the same time, 3:30.
Yes, 3:30.
And,
Instead of the 24th.
and the Councilmember Smith is unable to attend due to a small emergency, not a big crisis, but.
Okay, so we'll go on to new business, starting with AFG grant for personal protective equipment extractors.
Good afternoon. As you recall, County Public Safety and Finance Committee to seek council's permission to apply for a grant. This is the follow-up to the awarding of that grant for the turnout gear extractors.
And so I would make a motion to recommend that we move this up to council for approval.
And as you know, it will be going to Finance Committee as well. All of these items.
Yeah, these are all tomorrow for finance as well.
The SAFR grant for AFD staffing, is this all under?
Yeah,
Okay. Is it the same thing?
no, this is, you want to explain?
Yes,
what-
ma'am. This is for the SAFER grant, and this is to allow us to hire 9 additional firefighters. The grant program provides 75% of the salary the first 2 years, 35% the third year. The city has a match to make up the rest of that salary for those 3 years. After 3 years, if we choose not to be, or if we can't continue to sustain that, we will just absorb them into our regular workforce.
So absorbing them after year 2,
After
possibly?
year 3.
After year 3. But it still requires, in year 3, is it still 75% that's funded up through year 3?
The
I was
third
thinking
year-
the third year was more.
The third year is more.
65%,
60.
75, 75, 35 is the grant. So 25, 25, 65 is our match.
Yes.
Is that correct?
Yes.
So it obligates us for next, see,
Right at $500,000 over
Right.
the course of 3 years.
and I mean, at this point, we'd be obligated for the entire 3 years. Like, we couldn't stop it at the end of year 2.
Correct.
I mean, that's what we're being asked to look at.
Correct.
That's what I thought. I would make a motion to accept the grant funds from FEMA and for staffing for adequate fire and emergency response grant, and approve a budget amendment in the city's special revenue fund in the amount of $1,302,021 to fully budget the SAFER funds and the city's 3-year general fund match.
Second. Okay, move to item C, reimbursement from UNCA for emergency standby performed by Asheville Fire Department.
That is, I'm sure you recall, there was some concerns over the dormitories at UNC Asheville. The Department of Insurance asked us if we could support an additional engine company on site until those issues were resolved. That has been done, and this is them paying us back for that time.
Was there, overtime in other, I forget what you call them, the groups of people?
In other companies?
Yeah, in other companies.
Minimum staffing.
To,
This was.
cover this?
No, ma'am. This was completely voluntary overtime that was in addition to what we did in our regular minimum staffing. So we maintained our regular core minimum staffing just like we always do, and this was in addition to. And the bill that we sent them was 100% cost recovery for the time that we invested in doing so.
We even rounded up.
Probably 38 cents, maybe 40.
So I would make a motion that we move this to up to a budget amendment for city council authorizing the city manager to receive reimbursement funds from UNC Asheville in the amount of $153,000 in the general fund budget for the reimbursement.
Okay. Item D,
Sparky.
FM Global Prevention Grant for Sparky the Fire Dog costume.
As I'm sure y'all remember, we came to this committee and finance to apply for this grant. This is a portion of that we were awarded $2,800, something on that order. I can't remember the exact number, to replace our Sparky the Fire Dog costume. That is that's a big deal. There are a number of rules that the NFPA has associated with that mascot, and this will help us replace that costume for our community risk reduction efforts.
I would make a motion that we move this to city council to authorize the city manager to accept grant funds from FM Global and to approve a budget amendment in the city's general fund in the amount of $2,832.
Second.
Mr. Chair, I was
Yeah.
just going to say I have an update on the recent APD.
Okay.
This is from Ms. Ball, and we needed to give a more comprehensive update at the next meeting. Is the reason it was.
How long have we known about this?
As far as it not being.
Not being pulled. I mean, when was it?
Yeah, I think it was today. It was.
This one.
Yeah, this one.
Okay, now time for public comment. Anyone wishing to speak? That's 3 minutes.
Good afternoon. My name is Susan Robbins. I'm here representing the downtown Asheville residential neighbors. In early October, we sent a letter to the city manager's office expressing our concerns about the current noise ordinance and its ability to help maintain the physical and mental health of the population, which is a goal of our new comprehensive plan. We got no response to that communication as of yet, so we thought that we would come here today and make our points to you directly. I'm sure you know that the number of residential units within the downtown area continues to grow. As of September, there were 1,122 occupied units, and approximately 150 of those were newly occupied within the last year. The number will likely grow to over 1,700 units based on the permits that have been issued within the next couple of years. We're here to ask for a review and a revision of the city's noise ordinance. As far as it relates to health and safety, the World Health Organization has done studies that show that besides the obvious problem of hearing loss, there are a lot of other negative effects on cardiovascular systems, an increase in anxiety, depression, interpersonal problems, and decreased performance and productivity of workers. We also see in the comprehensive plan that the plan recommends 3 main growth areas, and I quote, that are the heart of its holistic vision for a more livable future for everyone. These growth areas are envisioned as the city's livability and vibrancy engine for the 21st century. One of those is our own downtown neighborhood. The growth in the number of downtown residential units, we feel, including the South Slope and RAD, cannot help but increase the proximity of residential units to other businesses, hotels, bars that create noise issues. So what we're hoping for is for the city to rethink the noise ordinance, consider reclassifying the zoning so that the CBD is recognized as an area that is becoming residential, at least partly in character, that the city consider having a more objective and less subjective way to identify a noise disturbance, and that the city become proactive versus reactive, so that building codes can be examined for new construction and remodeling and consider the requirement of noise mitigation when a building is going up next to a residential unit. We don't feel that what we have now is working, whether it's due to lack of enforcement, lack of understanding, lack of police staffing. We've seen a huge increase in the number of buskers using amplification this year over previous years. I know you're familiar with the situation on Maxwell Street. Our understanding is that council said that they would request more policing, more enforcement of the rules, but residents say that hasn't really happened. It's just an example that it isn't just a problem for us who live downtown here, but also in other parts of the city. So thank you for your time. We have other speakers from DARN who want to make some other points. Thank you.
May I? I'm Peter Landis. I'm also with DARN, and I live downtown. I don't have much to add to what Sue has said. It's a pretty comprehensive explanation of our concerns. But I will say that from a practical point of view, it is extremely difficult if residents have a noise concern to have that addressed unless there's something so extremely blatant that there's no doubt. One of the problems seems to be that, again, as Sue mentioned, it's subjective, so that if an officer is called to a site where a noise complaint has been lodged against, it's up to that individual officer to determine whether it's reasonable or not. One officer may determine it is, another may determine it's not, which means that it is entirely subjective, and there's no criteria that really apply to helping make a determination as to what is excessive noise. And once again, there are more and more residents moving into the downtown area. It's becoming less just a tourist/business area and as much a residential neighborhood. And as such, we feel that there is a real necessity for revisiting the criteria that are used to determine whether something is a noise problem or not. And so we would ask that you look into this and try to help determine what can be done to come to a rational decision as to how to handle this. None of us are opposed to businesses. We're not opposed to restaurants. We're not opposed to bars or breweries. We just think that there has to be some reasonable expectation that people who are living downtown will also be able to enjoy the peace of their own apartment or home going forward. I recognize that we've moved downtown, and we understand that downtown is, to a great extent, not like other neighborhoods because there are businesses. But again, downtown is not what it was 5 and 10 years ago. It is becoming more and more residential, and that has to be recognized as well. So thank you for your time.
Hi, I'm Diana Davidson, and I'm also a downtown resident and a member of DARN. Although I'm also an officer with CAN, the Coalition of Asheville Neighborhoods. So I wanted to mention that it's not just downtown that's having issues with noise. And it actually is bringing other neighborhoods together and coming together with CAN, because people in West Asheville have problems, people over near Mission and Kenilworth have problems, and noise is becoming more pervasive, and just more of a variety of it, and people are, complaining more and want some solutions. So I would like to suggest that the city become a little bit more proactive in how to handle it. I think you probably should make a decision about whether or not you think the ordinance is enforceable or not, because it's really not being enforced now. And there's two sides to that. I think that the police maybe aren't really seemingly enforcing it. You see traffic out there with mufflers and trucks with no mufflers and motorcycles just being way too loud. A lot of that is going on. But there's also an education component. I think the police actually, when we talked with them, encouraged us to go ahead and talk to people who were making the noise, or businesses or whatever. And it turns out, I think, employees like bartenders or managers of restaurants, they're just not familiar with the noise ordinance. They don't realize apparently that they're supposed to cut off noise at 10 or whatever the hours are at times. Construction people the same way. They don't seem to know that they're not supposed to start construction before 7 a.m. or on weekends or whatever, and residents will complain to them, and they make it clear they don't care. They're there to work, and if they're there 4:30 in the morning, that's what they're going to do. So I'm not saying it's probably easy to try to enforce that on a weekend and that sort of thing for staff, but it is not being adhered to at all. So if the noise ordinance really isn't working, then as other people have suggested, it might be time to really relook at it and try to come up with a better solution of what the noise ordinance should say and how we can really work with it a little better. So just to bring some of those concerns and comments to you. Thanks.
Anyone else around the noise ordinance? We've been having, go ahead.
So in December, the staff is going to bring forward some suggestions as to process and suggestions at, to kind of divide noise up, like barking dogs go one place, and make it clear with construction, like kind of tie the construction to actually their permit, so that it will be very clear as to what's allowed and the timing and that kind of thing. So staff is coming back to us in December, right, John? To public safety originally, to try to just make it a little more clear. The whole issue about reasonableness, apparently back when, and if you go back and talk to other council members that were on council when this was first addressed, noise is a difficult thing. The whole decibel thing doesn't exactly work, because it really changes according to, if you're sitting here versus right over here. It can make vast amounts of differences. Plus, the officers have to have machines with them all the time, decibel meters. So, and apparently staff looked at all the choices, choices on how you measure noise, and kind of came up with this reasonableness approach. So staff hasn't really been given guidance beyond that to kind of continue to use this idea of reasonableness. But I'm hoping that the ideas that staff have come up with, and council has gotten a preview of that, that it will make this a little bit easier and more friendly to people who have issues around noise. So stay tuned and come back on December 17th, and hopefully we'll have some suggestions that'll improve the process.
And also we're looking at possible changes in enforcement and how that
Exactly.
take place. So now, anyone else with public comment on a different subject or any subject?
Hi, my name is Patrick Conan, and I came today to comment on APD's quarterly report, and I did just want to, as a member of the public, it is somewhat frustrating to, take time out of work to come to a meeting and have the agenda changed without any notice. So I know sometimes things happen, but if there's any way we can get changes to the agenda, notifications to the public about that, I think that would be a better way to kind of respect the time of our citizens. But I'll definitely be back on the 17th to hear about it. I did want to ask, one of the main things I was wondering about with the APD quarterly report was the status of the policy changes around traffic stops for written consent and consent searches, because we haven't heard a public update on those in quite some time. And my understanding was that policy was supposed to be in place in October, and we're now towards the end of November. So I would request, if this committee is the right place for it, that we could get an update on those policies to hopefully move that forward. Because looking through the traffic stop report, you'll see a lot of our consent searches fall in the same categories that are supposed to be restricted. And I think for that reason, it is important that these policies move forward so that we can see what difference it makes, hopefully to increase equity in our traffic stop outcomes. Thank you.
Do we know where we're at on the written consent? Is it moving forward?
So we'll make sure that's included on there prior
Okay.
to the
Okay.
December 17th
And
meeting. So.
I would like to know as soon as possible.
Yes, sir.
Okay. Anyone else for public?
I appreciate Patrick bringing up written consent, because I too feel like you all voted for it. Who am I? Sorry. I'm Amy Cantrell. Thank you, Gwen. Would like to know that that's moving speedily forward and won't be held up due to personnel shifts and things like that. Because I think a lot of people who are average folk on the street in our community, this affects their day-to-day lives. And so I think that needs to move forward speedily as something that you all pass as policy. And so I just urge that to move forward as quickly as possible. I'm also here to speak about the Asheville Fire Department's pilot project, community EMT project, and just to thank the city and the fire department for that really wonderful work. And Beloved Asheville's street medic team had the opportunity to meet with you and your colleagues, and met with a lot of the community EMTs on the street doing work in a similar fashion. And so we're really hopeful that project can go forward. We feel like that makes a lot of sense in terms of what's happening in our community, and that old adage, an ounce of prevention is really powerful in terms of where we're spending our resources, and to do that in a smart way that really benefits the health and safety of the whole community. And so I'm here to speak for that, and certainly our street medic team are very much in favor of trying to see this go forward in a permanent sort of fashion, and to see it go forward as a partnership. So if folks don't know, Beloved has the first homeless street medic team in the nation that trains weekly with EMTs and registered nurses, and goes out to medic, particularly peers of the homeless community, and anybody else that they might encounter that has an emergency. So finally, I just want to again thank you for opening up a way to have a public restroom open overnight, and I've heard really wonderful feedback about that, and would like to see that go forward in a larger, more expanded fashion, perhaps in this year's budget. In a similar way as we were very creative in looking at hours of other restrooms nearby, and maybe looking at shifting hours as a way to open up more restroom hours in the downtown area and across the city in a way that is cost effective. And I must say that we heard at the Homeless Initiative Advisory Committee earlier this year from folks from the Department of Health about hepatitis A outbreaks, not in our area, but in other places across the country. And the number one thing that was really effective at that was vaccinations, and the number 2 thing was access to public restrooms and hygiene. And so I just say, you know, with everything in me, if we can continue to look at expanding that for everybody, for the health and safety of all our community, access to public restrooms is really, really important. And so we hope we can look at that with you all and move that forward also in the coming year. Thanks so much.
Anyone else wishing to speak? Adjourn.